Welcome back to Learning Pharmacology Pharmacy. Today we are going to study about drugs for glaucoma. So what is glaucoma? Glaucoma is a disease that affects our eye. So it is a condition in which intraocular pressure is raised. So what is the reason for this raised intraocular pressure? So let us see. This is an outline of eye. So there is ciliary body. The ciliary body will produce a fluid which is called aqueous humor. This aqueous humor will move through this posterior cavity. This part is posterior cavity through the pupil into the anterior chamber or anterior cavity, and from there it drains out of the eye through the canal of Schlemm, or which is made up of a trabecular network. So if any kind of blockage happens here and this aqueous humor cannot flow out of this or out of our eye through canal of Schlemm, pressure starts to develop inside the eye and which damages our optic nerve. So it leads to damage of the optic nerve along with loss of optic nerve tissues or excavation or cupping of the optic nerve head, that is depression in the optic nerve head. So that is what we call as glaucoma. And this glaucoma it may be accompanied by loss of peripheral and later central vision. Usually this glaucoma is painless, but loss of vision is definite. So what are the two chief therapeutic measures to lower the intraocular tension or intraocular pressure to its target level? It is by either reducing the secretion of aqueous humor or by promoting its drainage through the canal of Schlemm. Glaucoma is classified into two types. They are open angle glaucoma, which is also known as wide angle or chronic simple glaucoma, and angle closure, which is also called narrow angle or acute congestive glaucoma. Let us see them one by one. So let us see what is open angle glaucoma. So this, in open angle glaucoma, the etiology or the cause of this raised intraocular pressure or tension is not known. So it is probably a genetically predisposed degenerative disease that affects the patency of the trabecular meshwork. Patency means the state of being open or unobstructed. So the patency, a disease that affects the patency of the trabecular meshwork, which is gradually lost past middle age. So let us see the drugs which are used to treat open angle glaucoma. First one is beta-adrenergic blockers. So this topical beta blockers are one of the first line drugs to treat open angle glaucoma, but nowadays PGF2 alpha analogues are increasingly used. So this beta blockers lower intraocular tension by reducing production of aqueous humor by the ciliary body. Now let us see the side effects that beta blockers causes to eye, or ocular side effects of beta blockers. They are stinging, then redness and dryness of eye, and blurred vision, which is generally mild and infrequent. And major limitation of this beta blocker is its systemic adverse events like bronchospasm, bradycardia, and they also accentuate heart block and CHF, especially in elderly. An example of beta blockers are Timolol and betaxolol. And in fact, all adverse events and contraindication of systemic beta blocker therapy applies to beta blockers as well. So next one is alpha adrenergic agonist. This alpha adrenergic agonist, they lower intraocular tension by reducing aqueous formation. How they reduce aqueous formation? By activation of alpha 1 and alpha 2 receptor in ciliary body, and also by increasing uvoscleral outflow. What is uvoscleral outflow? It is drainage of aqueous humor from anterior chamber into the anterior chamber angle other than through trabecular meshwork. Examples of this are adrenaline, ipreclonidine, and brimonidine. Third one is prostaglandin analogues. This prostaglandin analogues, low concentration is preferred. That is, low concentration of prostaglandin F2 alpha lower intraocular tension without causing ocular inflammation. and it acts by increasing uvoscleral outflow. Example is Landano-Prost. So next is carbonic anhydrase inhibitor. So this carbonic anhydrase inhibitors, they lower intraocular tension by decreasing the production of aqueous humor by the ciliary body. Example for systemic carbonic anhydrase inhibitor is acetazolamide, and for topical is dorzolamide. And this dorzolamide is used only as add-on drug to topical beta blocker or prostaglandin analogues, or when these drugs are contraindicated. Next is miotics. Till the 1970s, topical pilocarpine and or anticholinestrates. These both are miotics, were the standard anti-glaucoma drugs. Because of several drawbacks, they are now used only as the last options. And in open angle glaucoma, these miotics will lower intraocular tension by increasing ciliary muscle tone and thereby improving patency of trabeculae. Patency means the condition of not being blocked or obstructed. So that is the function of miotics. Now let us see the summary of current approach to treatment of open angle glaucoma. So the therapy start with Landano-Prost or a topical beta blocker. And if we are unable to attain the target intraocular tension, then we either change over to the alternative drug or use both Landano-Prost and topical beta blocker concurrently. And the drugs brimonidine, dorzolamide, they are used only when there are contraindications to PG analogues or beta blockers, or to supplement the action of this PG analogues or beta blocker. And topical miotics and oral acetazolamide are added only as the last resort. So this is the summary of current approach to treatment of open angle glaucoma. So the second one is angle closure, or we also call it as narrow angle or acute congestive glaucoma. So this angle closure glaucoma, it occurs in individual with narrow iridiocorneal angle and shallow anterior chamber. In angle closure glaucoma, this green color part is the iris. So this iris touches the posterior corneal surface and thereby obstructing the angle, and the IOP rises as the aqueous humor cannot flow out of it. In angle closure glaucoma, the IOT remains normal until an attack is precipitated, which is usually by mydriasis. And in this case, the IOT rises rapidly to a very high value, and it is an emergent condition. And failure to lower the IOT quickly may result in loss of eyesight. And for that, in angle closure glaucoma, reversible anticholinestrates are used to reduce the increased intraocular tension. And the contraction of sphincter of iris, which is induced by anticholinestrates, removes this iris blockade and facilitate the drainage of the intraocular fluid. In emergency cases, 20% mannitol may be infused IV to lower the intraocular pressure. And this acute congestive glaucoma is a medical emergency, and combination of pilocarpine nitrate 4% with physostigmine salicylate 1% is the preferred treatment. And also adjuvants such as acetazolamide are also used. And once the acute attack is controlled, definitive surgery is advised. Thank you for watching.